Hi everyone, welcome back to my channel, RA and myself. This is Effie, and I am having a YouTube chat today with Jen. I connected randomly after she reached out to me about the book Keeping It Real with Arthritis, and she was just really inspired to share her own story.
Okay, yeah. Well, my name is Jen, and I was diagnosed when I was 1 years old. I woke up with a swollen ankle, and my parents thought I got it caught in the crib, so they took me to the doctor, and they said she has juvenile rheumatoid arthritis. For me, I mean, as much as I know, because I was so young, it was a quick process. I know others, it's taken time and misdiagnosis and all those things, but the story I got at that age was it was just quick, and they knew that was what started my whole journey with arthritis.
How long ago was that?
So I'm 39, so it was 38 years ago when
Oh,
I was
wow.
diagnosed.
How was it, obviously growing up with it? I don't know if you remember too much of it when you were one. Some people recollect things when they were that young, but not everyone does. But I don't know if you have like any memories of how that was.
Yeah, so I don't remember a lot when I was like 1. I mean, I definitely remember when I was young, probably like 3, 4, 5, just because like it was so much as a child. The medications weren't as good back then, and it was just a big guessing game, a big waiting guessing game. And you would take a medication, and we'll see if it works. Come in 3 months, and if it didn't work all that time, your body's being affected, your joints are being affected, like you're in pain all the time, swollen knees, wrists, all those things, and so, like, for me, I did like physical therapy every single week, twice a week. I got my blood drawn every single week. I had doctor's appointments every month. My rheumatologist at the time, I was at Children's Hospital in San Diego, said this is like one of the most aggressive cases she's ever seen. Um, and I would agree with her because I lived it. And it did, like, I have like my wrist looks different and stuff like that because things just move and do whatever they want. But as a child, like, I was hospitalized twice, once in San Diego and once in Los Angeles. And that was probably around the age of like 8 and then like 10. And it was horrible. It was just so they could do like around the clock physical therapy. I was serial casted also 2 times, which just means that they cast my knees started to bend and they weren't like going straight. And the doctors decided that I wouldn't be able to walk like that, so they decided to they would cast me, and then every 3 days I would come back, and they would recast and keep pushing my legs straighter and straighter and straighter. It was horrible and painful, and it didn't help with my status in school either. It really made me look even more different, and I always say I was a loser because the odd man out gets a lot of made fun of and stuff. And then, I mean, even one time with the serial casting, they ended up like cutting me with the saw, which isn't the fun vibrating saw they have now. It was like a big circular saw. And I just think that a lot of the childhood things with arthritis for me was like where a lot of like probably trauma and like just some stuff happened because so much of it involved other people telling me what to do and how I felt and what I need to take and what how I need to move and I wasn't necessarily on board with all that stuff. So they would also consider me a difficult patient, um, and that's okay.
Yeah, you mean you need to advocate for yourself, and I think,
Yeah,
I think that they're quite opposite of a loser because I think at that time you were dealing with things no one really knew much about.
yeah.
And I think, some states were more advanced than others, and I know that with pediatric rheumatologists, there's a shortage in the country. So did you deal with that at all in your state, or did you just have a good, like, easy run with like finding pediatric
No, yeah.
rheumatologists?
I had one rheumatologist as a child, and I had her till I like aged out of Children's Hospital. But she like I told her, like, I saw her recently and I told her she tortured me. And it wasn't on purpose. She was doing the best she could with what she had, and
Yeah.
I was who I was, but I was the one, who was in pain, and I was the one who she forced this and that to happen to me. Um and so, like, but it was her the whole time, and, like, we didn't get along. At one point, she said I was in denial that I had arthritis, which is odd because if you look at my body, you can definitely tell that it doesn't look like everyone else. Not in a bad way, but just, it's different.
Yeah.
So, yeah, so, like, I had one, and then when I aged out, I had a couple other ones when I was older. I still have one now, but I have more like control and say because I mean I'm an adult now too,
Yeah.
so I can, you know. So those for me it wasn't a struggle to find a good rheumatologist in San Diego. And then LA also has good ones as well. I had like shoe inserts for my feet, wrist splints to wear at night, which I wore half the night and took them off and threw them across the room because it's very uncomfortable. They're very hot and itchy. I did have leg splints before they stereocasted me. It was a very Forrest Gumpy looking kind of splint.
You didn't have joint damage in your knee? I had a knee replacement too, and my knee was kind of bent, so that's why I was wondering, like, because I did braces a bit at work.
Yeah,
But mine was like a different type of brace for an adult who was dealing with that. But I didn't know, the connection between the braces they were giving you as a child. So that's why, like, if anyone's listening, because
yeah,
I
yeah,
don't
yeah,
know everything either about what people have experienced, that we're all so different. Yet we still have the similar experiences,
yeah.
ironically.
I had the knee replacements as an adult though, in like late 20s and then like one early 30s. I had them separately. Like by the
Mhm.
time I was like 28, 29, my right knee was starting to like buckle as I was walking. I'm like afraid I'm going to fall and break something else. They said there's no joint left, so let's do a knee replacement. They try to wait as long as they can because a very
Yeah.
wise doctor once told me that the original is always better, even if it isn't working as it should, you know? And so we waited. And then, yeah, I had my right knee replaced first, and it's was amazing. And I've never not had pain in my knees, and now I do, but they're not real. But it's one of the best decisions I've ever made.
Yeah.
And then a couple years later, 2 3 years later, I had my left one replaced, and so yeah, they are both been I've been upgraded. I've never babied myself, you know, and that's like one thing as a child too. Like I've always just had the mindset, which I think is amazing. Because it served me so well, especially when I was young. It was just like my mind would be like, just keep going. Like I would literally be walking and dying in pain, and I would not show that I was in pain to anyone. And of course, there's a reason I wouldn't show it. Why didn't I show it? Because I felt like it made me look like I was weak, right?
Mhm.
So I wouldn't show anyone my pain, especially as a child, right? Because I got brothers and I got like people at school who I want to not be seen as different, you know, um, or special, or she needs help. Because for me, I considered it to be that I look like I was weak. Now that's not the case as an older person. Now I realize this, but as a child, it was one of the hardest things for me.
Did they offer you assistive devices or even like therapy? Like, how did you overcome those battles?
Yeah, no, I mean, I would like sit out for PE because when I was in elementary school, there was no adaptive PE. You know, everyone's
Yeah.
running the banks of the school, and I'm just sitting on the bench over there. And then, like, there wasn't like any like adaptations or anything like that for because I mean, there was no stairs, it was just walking to the class in San Diego and stuff like that. And so, other than that, it was just I would go to physical therapy, a school bus would pick me up during school midday whenever, and then bring me back. And I would do that twice a week. And so that was mostly as a child, like that was, so there was no real like accommodations, which for me was okay because, like I said, I felt like I was different if I was doing something or being treated differently than other kids. But for me, emotionally, I definitely think that my brain like kind of shut down the emotion part, like because my arthritis was like so bad, right? Like as a child too, and like I have like a way stronger mind as an adult, like because I'm an adult and I have an adult brain, you know. But as like a child and a child's brain, like you're still learning to feel and to regulate and to process and to understand what I'm thinking and feeling and why, and and then to navigate that also with being in like chronic pain, like pain like a lot. um like I think my brain kind of shut down the emotion part and like boosted the like mind
Survival,
strength.
maybe
Yeah, the
aspect
like
of
just
it.
keep going, just and like but to the point where I would like not feel like as in I'd feel the pain, but I wouldn't let like an emotion overtake me with it. And I would cry at times and stuff like that too. Um and but of course because I'm a child still,
Yeah.
like
Was
I
there ever a moment though where you were kind of forced to deal with that and not push it aside?
There were moments, but that's just because it was so overloaded. Like when I was in Los Angeles and I was like hospitalized for like a month, and it was just for like the round the clock physical therapy. And they said the children's hospital in Los Angeles was even better than San Diego. But my family lived in San Diego, and my parents had, I had brothers, I had three brothers. So they weren't there with me. And that was really hard because like I was isolated. I was in the
Mhm.
hospital. I was with strangers in a strange person in my room, whatever, my roommate person. I didn't know anyone, and they were like they serial casted me during that time, and so like I didn't have my mom or my dad or any like support. I'd call them, but it's not the same. And so I would literally put the bed all the way up, and then I would crawl under it and like lower the bed on top of me and just like call my mom and cry. And so like, like emotions will come, and like there's times where like they demand to be heard and seen. And like those were the times as a child. But I don't think I actually like processed it and like was realized what I was feeling. I was just feeling what I was feeling, and like sadness was definitely there.
Yeah. Well, it seems like you had a good support system though, because some people don't even have that. So then they have to go out to outside sources to help,
Yeah.
or sometimes people do have both, it just depends what is in kind of like your vicinity of, assistance and help, and what you're willing to do for yourself too. Because I know some people are not always like willing to talk about their emotions or even with people around them or even strangers,
Hmm.
so,
Yeah.
and I think it's harder when you're a kid too, and you're dealing with all like the things that comes with childhood, school, friends, and all
Yeah.
that. I mean, did you have like, how was your social life growing up with arthritis? Because I know I have like a lot of followers too who are, you know, were diagnosed with juvenile arthritis too, and they actually had to deal with it in grade school, elementary school, high school. I mean, for me, I was diagnosed at the end of high school. So I didn't have to really deal with that. If I was
Hmm.
diagnosed 3 years prior, I would have been like from freshman year to senior year dealing with it. But I didn't
Yeah.
really know what was going on. But I know like everyone has their own experiences with that. But I just never really heard many stories of people living with it in high school, except maybe the
Yeah.
people I've connected with. Yeah. So it'd be nice to
Y-
hear like how your experience was with friends. I mean, did you have anyone that you could confide in, or did they understand, or did you have to always explain, like that spoon? I don't know if you heard about the spoon theory, that
mm-mm,
was written. Her name is Christina Meridano, I think. I can't, I'm probably butchering her name, but she wrote this story based on what she said to her friend. And she has lupus, and she just described like the number of spoons she has throughout the day. And like, let's say she showers, that's one spoon. Let's say she like does her bed, that's another spoon, or like goes out to a social event, that may be four spoons. So like that came up like in 2005 or the early 2000s. So I was like, oh man, I wish I had this when I was like right when I was diagnosed. And luckily I kind of utilized it a little bit and shared it
mm,
with people around me, but still was like they didn't fully understand. So back then I just was wondering like, did you have to explain yourself to like classmates or like friends
yeah.
or, you know, because that's an
Yeah.
emotional toll too.
Yeah, elementary school, I had to do a lot of explaining because they're also kids, and all they
Yeah.
see is, she walks different and her wrist looks different. And why is she always out of class and where is she going on the school bus, right? So, like, questions. And so people would ask me, and I would tell them, oh, I have juvenile rheumatoid arthritis, which, of course, they don't know what that is in elementary school. So then I'd always just give my little recap. Oh, it's a disease that affects your joints. And then they'd be like, "Oh, okay." And then, so elementary school, it was like I think I had definitely had some friends, like a couple of friends. Um, and like they cared about me and all those things. I don't know any of them now, but in that time I did. But also, like, I was definitely made fun of a decent amount in elementary school. Junior high was better because kids are getting older and stuff. Still made fun of here and there. Had a couple friends, nothing like no big huge friend group. But no one really asked me why do you walk like that? That was way more of an elementary school thing for me.
Yeah.
And then um, high school was that was fine. I also had friends there. And some people would ask me, and I would just tell them same thing I would say in elementary school. I said in high school to them. But people were much kinder there. They just ignore you if they don't want to talk to you. So, um, but yeah. So I did. I had like a friend group, and I actually do know a couple of people from high school still. And some people who like would definitely like support me and who would be there and like, hey, do you need anything? Which of course I hated because I still did not want to be seen as different. So don't ask me if I need help.
Yeah.
Um, and I would always be like, I can do anything. I just might look different doing it, and that's 100% like true. Like, as it's like I never wanted, like I said, to be seen as different or I couldn't do anything. And like I said, I had three brothers, so I had to keep up with them.
You also want a little bit of your independence, which sometimes gets taken away in various degrees in
Hmm.
all areas of life when you deal with a chronic illness. So I think like when you're used to like doing things on your own and just kind of like, you know what I mean, trying to keep up with things, it's hard to like
Yeah.
go away from that,
Yeah.
especially if that's part of your personality too, or, and I think part of it, like you said, is like not wanting to be seen differently or whatever, trying to keep up with like appearances and stuff. But
Mhm.
I think also it has to do with like someone's personality too, and
Yeah.
how they have like that grit and they keep just going. I mean, I was like that too before my knee replacement, but then afterwards, I kind of did baby it a little bit for like a year afterwards. I don't know if you were like that after surgery, if you were kind of, or did you just like kind of like, okay, I'm gonna go do this, this, and that. Um, it's just
Yeah.
it can be a little different and traumatizing, right, when you go through a
Yeah.
procedure like that.
Yeah,
So
for me with the knee replacements, it was just I babied it to a point because I only babied it because I was unfamiliar with it, right?
yeah,
Like
yeah.
so like what can I do? You know what I mean? Like and I remember the first time after my first knee replacement where I felt like strong. And I mean like I was like working on a thing, but like I felt like I just had strength in my knee, which I didn't. I felt stabilized, I felt, strong, like there was no pain when I walked, like it bent like a normal knee, you know what I mean? And it just felt so good. Like, and it just happened. Like it just, the realization came and like I felt everything with it. And it was just amazing to feel like this, the strength and stability and everything of it. So after I realized, okay, I'm good. I can do most of the things I want to do, right? Like I'm not boulder jumping and doing crazy stuff, but I can do like the things that I want. And like it was dependable, it's strong, and it's only gotten stronger, obviously, because now it's functioning and moving properly as it should. So I can strengthen all the ligaments, joints, bones, all the things around it.
Yeah. Did you ever deal with scar
A
tissue?
little bit of scar tissue, but only on the left knee because the left knee was bent so little by the time I had the knee replacement. Like literally bent like 15 degrees. It was sad. Like I was
Oh,
like
like
the
it was
person.
more severe, you mean? Yeah.
Yeah, it was like the bending was not there at all. And I was like the person who was like dreading getting to the back of a small car. Because I'm like, I'm not gonna be able to bend my knee far enough to fit behind this seat in, my friend's car. What I always did. But yeah, my left knee a little bit, and it's just because it didn't bend. So like the scar tissue was like even worse. And then like the whatever that bending ligament on top of the thigh is that goes down was so tight. Like the doctor's like, don't snap it. And I'm like, don't say
So did
that.
you have a problem bending your knee or straightening it before
I had
surgery?
problem bending.
Oh,
By
okay.
the time I had my knee replacements, it was bending was my issue.
Oh, mine's the opposite. I couldn't straighten it. So it's just so interesting how like everyone's like
Yeah.
complete opposites or the same. It's really weird how that works out. I don't
Yeah.
get it. But yeah, I
Yeah.
know. Yeah. So for me it was like I couldn't straighten it, and then after surgery it was like the bending was a problem because of the scar tissue. But
And it's funny, I always noticed that one side was better with the joint than the other side. Like my right
okay.
wrist was better than my left wrist, and my right knee was better than my left knee, and my left shoulder was better than my right shoulder. It was
Yeah, do you
just
have like
like
a
weird.
specific side where it's worse for you?
It's just for each joint, it's different.
Oh,
It's
okay.
different for each joint. Like yeah, like
For
I
me,
so
it's just
I've
my
also
right side that's the worst.
really.
Yeah.
That's so interesting. Mine just like whatever it chooses to
Yeah,
take,
right?
it takes. And like my right shoulder also replaced, which was great because I didn't have much. I couldn't like lift it high, so I can now. That was wonderful. I did that like literally 2 years ago. That's a fresh one for me.
Oh, so how many like surgeries have you had?
So both knees, right shoulder, and then I did not get anything replaced in my ankle or foot, but I did have a surgery because so before this is gonna sound super weird. My left knee, like I wish I had something to use an example, kind of like turned out when
Mhm.
like from my knees started going toward the left. I used to call it my K leg because one leg was this and one leg was that.
Oh, yeah.
And so naturally my foot was out a little bit more, and so it was at an angle and the body adapted. And so like my foot was kind of at an angle. Then knee replacement, both legs are straight. But my foot that adapted was kind of at an angle, and it was just like hurting
Yeah, like
because it put
the
in
pressure
pressure.
from it, yeah.
Exactly. It was putting in pressure. So they did like the surgery where they extended my Achilles and like moved my foot back over and like put like screws in
Mhm.
it to hold as it healed, and it's like whatever. So it wasn't a replacement. It was just like a correction, we'll call it.
Yeah.
But that's all the surgeon have had.
Yeah.
So
I mean, I think that's the downside too of like them telling us to wait, wait, wait. Because like
yeah,
over time, like other body parts can get
yeah,
impacted, like
I didn't realize
whether
that.
that's your other
Like,
side or your other joints on the same side, it's like um, it's better
like
just to
for
get it done when
for
you
my
can, right?
shoulder, yeah, for sure. For my shoulder, like I saw a doctor, and at first he was like, "Oh, you waited too long," and then I was kicking myself because I didn't realize that I waited too long was a thing because I was like, "Oh, the original's the best, right?" And he's like, "I think all we can do is fuse it," and then I was like, "Well, what does that give me as far as like motion?" And he's like,
Mhm.
not as much." And I'm like, "No, no, no." And I kept going to him and kept seeing him, and he seemed very not confident, right? And I'm like, I need someone who's like more confident. So I went to see another guy, and he's like, "Oh yeah, we could totally do the replacement. We could do reverse or regular." He's like, "You pick." And then I'm like, "Well, okay, I'll pick." And I did pick. I picked a reverse for the record. Um, and but just the fact that I literally saw the guy who was just, and I appreciate if he was hesitant, like I don't want the God complex people. But just a little bit of God complex because I do want confidence. I want someone confident going in me, and
Yeah.
I'm giving someone permission. So if something goes wrong, unless they leave a towel on me, if something goes wrong, it's on me. Like I'm signed the paper. I'm like, yeah, yeah, you can hack my shoulder and just throw it away and put a new one in. Um, so like I would carry the responsibility if something went wrong, other than like an infection or like I said, towel or something. Um, but like that was a struggle, and I was like super discouraged because I was like, no, there's got to be something better. There's got. I mean, we allegedly we sent some to the moon. We can do something else. Come on, come on. But
No,
then
and
I
that's
did.
what
I
I
met.
learned too is like there's going to be like doctors who do certain surgeries and others that don't. And like I remember when I was looking for one for my knee, it was like I don't know, I just collected a bunch of names or just looking through the database of each hospital and you'll be able to see like this person only does 16 up or this person only does 35 and up or this
Mhm,
person doesn't do young patients and I just went for the person who does like complex surgeries on young patients. So you have to just do your research because they are out
yeah,
there. There are
yeah,
people who will do it and who are confident, in their abilities to help people who others may not want to or not be able to or may not have the knowledge. And it's not that I
mhm,
don't think they wanna help, I just don't think they, like you said, have the confidence, but don't know how to really go about it.
yeah. And
Yeah.
that's definitely what it was. So that was like a process, and then I found the other guy who was like super confident, and I was glad. I wanted him to be confident because if he's not confident, then I'm not going to be confident having him do it and going into it, and then you never know. So
Yeah, I know we're kind of running out of time. This chat's like zoomed by, and I'm sure we'll talk again at one point. But
yes.
there was something that you like sent me. You were like a written piece, and you were talking about like just your experience with like rheumatologists and like sort of being silenced, quote unquote. Do you want to touch on that a little bit, and then maybe share like just like uh, not necessarily advice, but like any tips? I guess advice or tips is the same thing, but just like words of wisdom for people like who are just kind of going through similar situations, whether it be surgeries and diagnosis,
Mhm.
kind of seasoned like me and you are with,
Yeah.
diagnoses for like decades now. Is there anything else you want to like add to that?
Yeah. So for me, like I said, the thing I wrote because it was just so impactful for me that day was I saw my childhood rheumatologist after like 30 years, 25, 30 years. And like there was so much there, and like just history with her, and even before I actually saw her, like I would Google her just to be like, I wonder if she's still like is she still the rheumatologist at Jones Hospital, and is she still torturing people? No, that was just my
Yeah.
it was rough, and so to the point where I'd be like, do I have like bitterness towards her? And I might have because it was a lot and painful. But I saw her at a 5K for the Arthritis Foundation we have in San Diego, and I think they're in other states and
Yeah.
cities too. Yeah,
Like
and
throughout this month of May, I think they're doing the
oh,
arthritis
yeah,
walks, right?
yeah, yeah, yeah,
Another
yeah. And
month. Yeah.
yeah, so I saw her, and she remembered me, and I showed her my wrist, and she put both hands on it, and she said, "This doesn't happen anymore because it's moved. It looks different." Which immediately made me want to cry because now I am in touch with my emotions.
Yeah.
But that was not the time or the place. um, and then even later on in the time where I saw her, she was talking to another doctor, and she was like, "I've known Jennifer since LA, and she's had splints and casts and therapy and all these things." And then she looks at me again and she said, "You missed the good drugs by 10 years." Also wanted to cry because in my mind, the way I looked didn't have to be the way I looked because the drugs weren't as good 10 years, like when I was born 10 years earlier or whatever, early before the good drugs.
Yeah.
Apparently they came in the 90s and not 1984. So like those were really hard moments, but also kind of healing. And I told her, I was like, well, I don't know if I should say her name, but whatever. I said,
No, you don't
"You
have to.
tortured me. Yeah, you tortured me when I was younger." And she looked at me and she said, um, "I know I did. I'm sorry." And it seemed sincere. Like it was just, and for me, if anything, it was more like a healing moment for me.
Like an
The whole,
acceptance sort of.
yeah, yeah. And so that, um, but I mean, like, so as far as rheumatologists, and even now, like, I mean, my advice would be like, you, a lot of times doctors are like, "I'm here for you," but that's really not true. Like me, the patient, you're here for me. Like when I go to see a doctor, a rheumatologist, any sort of doctor, little do they know I'm interviewing them. You know what I mean? Like, are we going to work together? Are we gonna like partner up? Or are you going to say, "No, you need to be on this medication"? And I'm going to say, "Tell me the side effects of that medication, long term, short term." And you're going to say, "Don't worry about it. Just take it. You're fine." Like, I'm not good with that. I'm like, "No, no." And I've researched. So research everything too. Like, go in knowing, right? I used to be, for a time, I don't recommend this. I used to be the girl who would take the prescription, but yeah. Never fill it. Never, never fill it. I'm gonna go home and do research on it first, see if I want to put it in my body. Um, and like I said, the drugs are way better now. The side effects are even way better now. Um, as in, like, there's less side effects on the body.
And there's
There's
more
still,
things you can do on the side to help with side effects.
oh, absolutely. And
Like
that's where
alternative supplements, whatever there is, yeah.
I am more of that. I'm more towards that route. Like I try to, with diet and like supplements or whatever. I just try to eat better and take less medication. And that's just for me. Everyone has their own decision, their own choice.
Yeah.
But also for me, when I'm looking for a doctor or rheumatologist, I already go into it knowing that, and they're like, take this prescription," and I'm like, "Well, what if we change the diet?" And if they're not on board, because they'll just shut you down. "No, no, it doesn't work. Just take this infusion, take this injection," which is fine. I'm glad there are options, because they really can really help, especially children right now, because I was a child with it and it was rough. So
Yeah.
if I was living now, back then, I would have more options and things would be different. But yeah, I would definitely go into it looking for a partnership and not necessarily someone to just tell you what to do. And that's not bad. A lot of people like that. Like, "Okay, I'm just doing what the doctor
No,
says."
I agree
And
with you
that's
100%. Yeah, I feel like a lot of us are kind of a lot of people I talk to who are more seasoned on this journey, we have the same mentality at this
Mhm,
point because we had to learn the hard way a little bit too, I think. At the walk, you said that you kind of, felt your emotions when you were speaking to your doctor. What
mhm.
is like one thing that you could give to people, like when in terms of words of wisdom, to tap into their emotions? Like, how did you go from like that to like all of a sudden feeling that and like honoring that for yourself?
Yeah. So, like I said, when I was younger, I feel like my brain just shut that part down because it is what served me the best
Yeah.
to push through and keep going and have the mentality and be who I am and all those things. But as an adult, I realized like, hey, maybe this isn't the greatest, because people be like, "How are you doing?" "Fine, good, fine, good." Or I would just have to be like, I don't know. Like that would be my answer. "I'm not sure. I have to think about it. I don't even know how
Yeah,
I'm feeling."
there's so many
That
things
would be
going
a
on, right? Like, I
response.
don't know how to answer
Yeah,
you, and sometimes saying,
yeah.
"I'm good, I'm fine," is, like, the easy answer, right?
Yeah, yeah, now I'm like, "You don't really care if that's the answer I give you." No. Um, but and I had some friends who kind of were like, "You kinda seem like you're not really, don't really know how you're feeling, or not, you're not," and I
They're
have
calling you out
kids.
on your stuff.
Yeah, yeah, and I have kids too, and I, to the point where I did not wanna pass that down to them. I did have the very much suck it up mentality as a child, which once again served me well, and I'm very thankful that that
Yeah.
was it. But I realized that, like, okay, this isn't what I wanna pass on to my kids. Like, I want to feel everything I'm feeling. Emotions are good. People think they're bad. They're not. It's just a little warning, like, "Hey, something's wrong. Take a look at it." It wants attention. It wants to be seen. Um, and so I would have to just like sit with myself and like even ask, "What am I feeling?" And even I would even go through like the emotions chart, just because, when you think about emotions, sad, anger, happy, and then I'm like, well, what else is there? Disconnected, unheard, unseen, unloved, uncared for, right? Like these don't just come up naturally in my brain. So like those are things, and that do pop up. And so I literally just had to like sit with myself, or if there was someone who I knew who could help me to like process or ask questions or just let me share and to just be heard and like hold that space for me. And it's taken a long time, and it's a journey, and it's a lifetime journey for me, but I have gotten better at it. And they say your body stores emotions, which I absolutely think it does.
Yep.
But to like release it, to like let that go, even the pain, like I think pain is not talked about enough. And then not necessarily, because I think it's talked about as in how to stop it, but how to partner with it, and how to like turn like your pain into power even when you're feeling the pain, like I think there's a lot there to be learned, and to just to overcome with it.
Yeah, what you were saying about the turning pain into power,
Mhm.
uh, we left off on that before the video cut off. So you want to continue a little bit and then we can just, go from there.
Yeah, I mean the pain part, like we all have it. Even people without arthritis have it. Like that's something that's universal. Everyone can experience pain. It just depends on what kind it is and how we deal with it, and absolutely, like you can, so much we want to just stop it, and which is okay. Like of course we don't want to be uncomfortable and feel the discomfort of whatever the pain, whether physically, emotionally. And I think physically affects emotional, and emotional affects physical, 100%. And so, but like to actually just at times just let it be, instead of like pushing it away, and trying to not, like feel it, to feel it, like turn your pain into like the powerful part of it, like because it's one of my biggest teachers is my pain, like to see who I am, to the character I have as a result of me looking back, and seeing and hearing, even from people who have known me in my whole life, my mom's best friend, and her experience of me, and then just other people's experience, um and a lot of it has come through all those hard times, the times that were uncomfortable, and hurting, and my whole life, like even as adult, before my knees were replaced, like every step I would take I had pain in my knee, every step. um and I would sit with it, but of course I live life, so I would also just push through with it and pick up my kids from school, whatever, um but I just think that there's so much, and a lot of times we just try to numb it out. And not necessarily, I don't mean numb it out with like drugs or alcohol, but like even just get rid of it, And of course, because also with arthritis, damage comes from it, my joints are damaged. Some of them look different, some have been replaced, Um, but just to allow the things within our body, because it's always speaking to us somehow, whatever it is, like our body's always saying, we're hungry, eat, we gotta go to the bathroom. Let's move our body. We feel low, we feel depressed, like look at something needs to be addressed, something wants to be seen and heard. And for me with arthritis, there are times where I say like, um, it's like screaming so loud, and because it won't be ignored, right? And that's a lot of pain. That's a lot of discomfort or inflammation or whatever my body is doing at that time. Just to be there in the moment. Of course, you don't want to live in that moment, but just acknowledge that it exists, and then even to like look at my body, which is or whoever's body, and to see the strength in it, right? Like my wrist looks different, but everything it's been through and the way that it's like supported me literally, or like my legs, my knees, I have the two scars from the surgery. Um, like to see it as like strength, because it is like the body can handle a lot, and we put it through a lot, and we put it through a lot willingly, like our by our own hand, whatever it's like, poor foods we're eating, excessive drinking, whatever, drugs, you know what I mean, like bad drugs, not pharmaceutical, well, pharmaceuticals can be bad,
I get what you mean.
but yeah, just like not to ignore the things that will eventually demand to not be ignored, whether it's emotionally or physically. It exists. Acknowledge it.
Yeah, and then one thing, like how many kids were did you have or do you
I
have?
have 3 kids.
Wow, and so did you do that, like, after your surgeries, before your surgeries? Like, how was your experience like? I know you can probably talk a lot about it, but, just for those, like, women who wanna be moms or who are moms, like, how did you deal with the pregnancies and, like, even afterwards? Like, just
Yeah.
yeah, just
So I didn't even know if I could get pregnant, right? Because diagnosed at 1 on medication super early. Everything's
yeah,
growing, like you said, still,
right,
like all my woman parts are still whatever. And the doctors told my mom, like, we're not sure if she will be able to have kids. And she had to make decisions as I was a child and didn't consult me because I was a child on what medications I should take and if I should and shouldn't. And I've had a lot of medications. But apparently I am quite fertile, it turns out. And it was easy to get pregnant. And then once I did get pregnant, I was off all medications. That was my choice. The whatever baby doctor people said that it was okay, whatever medication I was on. I think it was like I don't even remember the medication I was on then. It
yeah.
was an
There's a few
infusion.
medications you can be on. I know Humira. I think
Yeah,
one of them, I don't know. There's some.
I
Yeah,
thought it was Orencia. I think I was on
I
Orencia. It was
think
an
something
infusion.
like that. Yeah, but I could
Yeah,
be
they
wrong.
said they tested on the monkeys, the pregnant monkeys, and they were fine.
Oh,
That was her
geez. Oh,
selling
gosh.
point. That was her selling point. Um, but I went off 100% because I wanted to, and there was like fear with it because I'm like, well, if I have a girl, our autoimmune diseases are way more in women than men
Yeah,
statistically. And I was like, so I had 2 boys and then I had a girl, and my girl is one of the healthiest children I know. She's nothing. She's perfect in every way, shape, and form. My boys are too. Pregnancies were fine, typical. But after I had the babies, my arthritis was like, we're back now.
mhm,
We gave you 9-month break. Okay, we shut the immune system down ourselves, but now we're back with vengeance. And so I was breastfeeding, and I still did not want to be on medication because just in case. And I was the little girl who's like, I just don't want to take any chances with the kids, right? Of any of them getting anything or anything. And then so my first pregnancy, it was about I made it to like 8 months breastfeeding, and then I made my own formula. Yep. And that's a fun story. And then I got right back on the infusion and, kind of tapered everything down. And then every pregnancy was the same. I would cold turkey it. I was fine when I was pregnant. It was just after. But I had already had one, so I kind of already knew. I was able to plan with the second one. I knew it was going to come back and be like, "Hi, we're back."
yeah.
And so I would do the same sort of thing. I breastfed, pumped, stored. I stored this time. I turned out to be quite the breast milk producer, and and then I would also make my own formula towards the end, and then the same thing with my daughter. I would pump, store, all that, and then make a little bit. But because by the time I got my third child, I was able to go longer with breastfeeding. I don't know why, just what the body was doing at the time. But yeah, like you can have healthy kids and they're completely normal because I didn't know, and my
I
old
think that's a
doctor,
major concern for people. Like,
yeah,
am I going to pass this down?
yeah,
And I
100%.
mean, that's not really how it works with, sometimes it is, sometimes it's not. It's just kind of
Yeah.
like a fluke. Like, we're the chosen lucky ones. And sometimes other people aren't. So,
And I'm the only one with it. So, but it's
yeah,
good.
I mean, that's kind of similar with me too. I mean, it's just like I'm the oddball out. Yeah, no, I mean, like what you said is like it came back with the vengeance. And I think that's kind of like how rheumatoid arthritis, juvenile arthritis acts. We may be sick with like a regular cold and we'll be feeling fine in our joints. But once that, cold goes away, then the arthritis comes back. It's not
Yeah.
just with pregnancy, right? It's like with everything that we may
Yeah.
experience, and people don't really get that. So I think that's like an important thing to add too if anyone's watching and they don't know anything about arthritis, or they have a family member or friend and they just want to learn. Because I have a lot of people who watch this and they're just watching for someone else. You have a wealth of knowledge, and I think we'll talk again and do one of these again because I think you have so many things to share. So I really want to thank you for coming on, Jen.